Good afternoon. My name is Dr. Jim Weiss, and I'm here today with Dr. Tomasak and Dr. Bob Barucki to discuss COVID-19 and also to talk about some of the medical as well as some of the social aspects. I'm going to start with Dr. Barucki. Dr. Bob, last couple of weeks we've been chatting, and as you said, to raise my YouTube numbers, but actually I haven't been on YouTube. So this is the first time we'll actually do a YouTube video. Some of the new drugs that are out people are really focusing on are remdesivir, convalescent plasma, and or using vaccine. I'd like to hear from you a little bit about your thoughts on them as things are evolving and see what you think about remdesivir now. It's been out for a week or two in the news. Any new thoughts on remdesivir?
We were kind of excited about it back in early March and thought this may be useful. And now that they've had a few clinical trials, it looks like that drug is pretty useful for severe cases. For hospitalized severe cases to keep them from progressing to ventilator and worse.
So it's an excellent repurposing drug, and it has some efficacy so far. How about convalescent plasma?
I think that looks also really promising. A little harder to study, and I don't see any definite numbers out yet. But the anecdotal reports of using it in people who are severely ill and have shown some recovery. So I think that's going to be a real useful tool also.
What do you think, Dr. Tomasak?
I'm not going to have to make any changes on those statements. I mean, right now I just stick with the American College of Occupational Environmental Medicine since I do a lot of the peer review and the occupational medicine side. And those two drugs are in the recommended category. We still need to do a little bit more research to ferret out the benefits and risks. However, just like Dr. Bob said, we are going to be continuing to use them in our guidelines, especially in the higher risk and the higher end people who are going into the ICU.
So, Dr. Tomasak, can you give us a little bit of your background? I know you're a family medicine physician and board certified. Tell us a little bit more about your background.
How far back do you want me to go? So originally, I think you and I had met through our occupational medicine exploits. We did the American Academy of Disability Evaluating Physicians, those designated doctor work. And then I guess if we start with my background all the way back, I can say I started off as a chiropractor. So I did the conservative route first, then went into medicine, and now not only did I do the Family Medicine Board, but I've finally gone back and done my secondary American Board of Medical Specialties in addiction medicine, which is kind of that full circle for me. Started off as chiropractic with no drugs, went into medicine, gave a lot of drugs, and now I'm in medicine taking people off of drugs again. So that's kind of my background.
I know that you and Dr. Bob have that in common, that you're both board certified in addiction medicine and family medicine doctors. There have been some new developments right now regarding children in the news with cases of COVID-19, and what are your thoughts on that situation?
Obviously, just like any upper respiratory illness, we're going to have people who will get infected from all age groups. The parents do need to be aware that children can still be infected with this. Children can still have a serious illness from this disease, and just from the family medicine standpoint, continue to practice normal public health protocols, recommendations.
Also, there was a new study from Stanford that came out Friday that suggested that the death rate of COVID-19, although it might be a tainted study and it hasn't been peer reviewed, might be similar to flu. Have you had any thoughts about that? Have you looked into that at all yet? Or not yet?
Looking at the numbers, as we get more and more testing done and we see that more and more people become infected, we will most likely see a larger population. I think there was a New England Journal of Medicine study where it was using some of Dr. Fauci's other statements based on his prior evaluations of the numbers, that eventually the case fatality rate will approximate or come down closer to some of the flus that we've seen in the past. I know we had one flu that was approximating 1% case fatality back in 1968. That was the H3N2 flu. So there's various forms, and the case fatality rate will alter as we get more and more data, as the data becomes more clear. Thank you. Dr. Bob, what do you think? The issue with children and the new study at Stanford.
The children, this pretty rare but strange multi-organ inflammatory syndrome. Fortunately, it's really rare. I've never been trained on it. I've never seen it, but clearly it's an entity that's arising out of this. And we just don't know enough about it. And it looks like treatment is supportive and hopeful. As far as the fatality rate, we can't get the equation right yet because of inability to do broad testing. There's reports that come out of New York that say 1 in 4 people are testing positive, with these low-level or asymptomatic cases. And whenever if you don't know the prevalence of an illness, you can't get a death rate out of it. We've all suspected forever that it's going to be a lot lower than what they were talking about early, 2%, 2.5%, and that it would be less than 1. But we don't know until, there's ongoing community studies where they're trying to document how many people in different communities have this antibody against coronavirus. But it's unknown right now.
Yeah, that's another argument about opening schools too soon. What do you think about that issue? That if we open the schools too soon, the reproduction rate goes up. Reproduction rate defined as 1 or 2 vectors, 1 or 2 people making this whole thing blow up as a large number of people developing COVID-19.
I mean, that's a scary concept, and I guess it depends on which hat you're wearing. I pretty much always wear my medical public health hat. And so,
well, you should wear a hat because you've got nice hair, and I wish I had hair like you.
But all of my goals are taking care of people, taking care of the community, and it's scary to think about. All the states are starting to open up, even when some states are having an increasing rate of infection.
Yeah.
I don't know what the answer to this is.
Yeah, Texas is the number of cases are rising. I looked at some of the graphs, the death rate's rising, and definitely the number of cases are rising, even though suggestion is that it's the number of cases that are being, we have one of the lowest testing rates in the United States. Dr. Tomasak, what do you think about schools opening? Do you think they should, at what point do you think they should open up? Or you don't have an opinion as a doc?
I mean, when you look at it, obviously, if we open up, things are going to change as far as the numbers. Yes, more people are going to get infected. The children, luckily, the majority of them are asymptomatic and carriers and or not affected with this more severe form of the disease. However, there's still going to be that are in that older age bracket that are susceptible and could have the more serious form of this disease. So pros and cons. Right now, I think the children are able to learn from home. We've got the ability, the technology to teach them from home. It's just whether or not their parents have the ability to manage and stay at home with them during the transition back to work and back to reopening the economy.
Okay, thank you. I'm going to get back to doctor questions, not so much social issue.
Right.
Sort of blending the two because they're so important right now. Dr. Baruki, question for you. Then I'm going to toss it back to you, Dr. Tomasak. Given the history of vaccines' efficiency and efficacy, do you think that you will get this disease or not? You personally, do you think that you'll miss it if you take precautions, or do you think at the end of the day, we'll all get it and you'll get it?
Okay, I have not done any post-antibody testing yet. So I don't know if I've had a low-level case. I plan on it.
Assuming that you have not.
Assuming I have not, then I've been fortunate because I've been exposed to some people that I know have it, and probably a lot of people that I might have suspected had it. But, enough exposures, I'm fairly confident that I'm probably going to get it before this is all said and done, because it's, getting a vaccine to market, if we can do it next year, that will be unheard of. It's not been done before. I think we can. There's a couple exciting things at Microsoft Genome Project where they're translating variants in people who are surviving this into all their lab data and translating it into some language that virologists can use to try to help target therapy and target immunization. But there's a couple exciting studies ongoing with immunizations, but that's still a long way away in the midst of a pandemic.
Uh-huh. So let's say that we have another outbreak, a large outbreak, November through December. We'll have some flu and we'll have some COVID-19. More people will get it. How many more years do you think we'll be going through this process where until we have some major herd immunity where essentially it's a much safer situation for the masses?
If you asked me a month ago about Sweden not closing their system down and them saying, oh, we want herd immunity and we're going to move on. We're going to protect our at-risk people, but we're going to let everybody else do what they want. So they've had a higher death rate, about triple what the other surrounding countries have had. I would have said that's crazy. You need 80% immunity to make herd immunity work for you, but and you can't get there. But then you hear reports of possibly 25% of people are infected during social distancing. And if that is the case, the Swedish model may not be so far-fetched, but you have to, without immunization, you're going to have to go through a whole mess of illness to get those numbers up that high.
The 25% that you quoted was from that country, correct?
No, that was from New
York.
That was a report out of New York.
25, but they have in the country that you mentioned, they have a much higher death rate, I believe.
Yes.
In New York. So it isn't, the jury isn't out yet whether that's the best tack to take, I think.
Yeah, I think, that's one of the things with this whole COVID-19 presentation, I've had to think and rethink many times because more information comes in and it's turned upside down what I thought was probably dogma.
But just philosophically, do you think that they're protecting the elderly by opening up the system the way they do? I mean, I believe they don't open up the stores, right? Some of the stores are closed, but generally their society is open.
It's pretty well open with a warning to the elderly, but the answer is no, they're not protecting the elderly in that setting, because unless you're totally isolating them from the people who aren't social distancing, you're not isolating them, you're exposing them secondarily. But you know, I don't know what the right answer is. That certainly kept their economy rolling and kept their unemployment rates, you know, down.
Yeah, actually, last week we talked a little bit about that and the economy and the issue. And I was trying to get an economist on the show today, and he said, "No, I don't want to talk about politics," because ultimately he felt like the economy and the politics were intertwined. So it's really up to it's going to boil down to what the politicians do with the economy, whether they open or close the economy. Dr. Tomasak, do you have any opinion on herd immunity?
Well, I mean, the numbers 80% is the correct number. It's what we all see in the literature for herd immunity. When you think about opening up America and doing that in America, you have to also remember that we have like a 16% of our population, the largest group by age, over 65 right now. So the baby boomers are in that age group. That 65 and over is the most susceptible to this disease. You know, I think it's 10% or so death rate from 65 up, 75 to 85. You start to creep up into that almost 25 to 27% as far as the case fatality. So trying to say that we can open up and meet that 80% without really overwhelming our medical system, there's no way. The best way to get herd immunity is through a vaccine, and we know that is years away at best. If you think about it, we've been working on vaccines for SARS-1 since about 03 to 04. So we will see. And I know that there's going to be a big change in how we manage the future from this point forward, as far as how we deal with public health and just our basic upper respiratory health and our public management of it.
Yeah, and even people over 50, there's a large percent of them, if you combine them with the elderly, that are included in that really risky population that gets seriously ill and dies. I think it's like, well, it's pretty high percent if you add them all together. Very, very high. Mm-hmm. My next question, Dr. Tomasak, is what do you think the importance of, you know, we're talking a lot about testing and tracing and contact isolation, and you and I are both in Texas, and there's not too much of that going on. I know they're trying to improve that. Do you think that it's necessary that we're going to have the resources to do that in our state? I don't know about Bob's state in South Carolina, but I mean, I don't see enough. I have a clinic. I don't see enough PPE in even the medical clinics yet. So I don't know how we're even going to be paying for, you know, I know we have like 100 in Houston, 100 contact tracers.
Right.
I mean, that's a pittance.
Yeah.
So anyway, just wanted your opinion.
The testing, obviously, I mean, I think we are getting a little bit better with testing. Personal anecdotal information, I know a person just got tested on Wednesday, got the results back by Friday already. Now, this was just the basic screening test. And so things are turning around better for the screening. I know there are apps that are coming out on telephone, you know, on phones, so that you can trace where you've been. Mm-hmm. I think it's called a Care 19 app. And so those can help people monitor where they have been if and when they become infected. That is a tool that the public health system can use for contact tracing. It's about all I have. Are
you guys having trouble getting PPE in your clinic?
I am not, but I've gone through my medical society.
Yeah.
My insurance for medical has also helped with that. And just personally, through my home, we've been able to acquire, online websites for personal home use as well.
Okay. You use gowns also?
Not in my clinic. In my clinic, I'm still using a telemedicine format. Next month, we will start opening up seeing patients individually, one-on-one. Staff has basic masks, and then we're going to use a waiting room, the parking lot waiting room model in the beginning, and see how things go as far as the community.
I don't have a high volume, but we use just a mask, N95 and a shield.
Okay.
Some kind of protective covering if I have anything like a doctor, a lab coat or a patient coat. I ordered gowns, but I haven't gotten them in yet for, like surgical gowns, and following the CDC guidelines. And I bought a plastic plexiglass screen for if I do in-close testing, like EMG testing, or if I'm with the patient, I put myself between a screen.
Very good.
So how about you, Dr. Bob?
Well, different. I work in doing different things in my use disorder work. It's all gone to telemedicine at this point, and so we've been doing that for the last 4 or 6 weeks. In the urgent care setting, we're masking up, and we haven't had any shortage of PPE. And then in my kind of industrial, my pilot work, we're masking up basically.
Do you think that you think that that's a thing that we're going to be doing in every state in the U.S., testing, tracing, and contact isolation, or do you think that that's just kind of a pipe dream? I know in New York, the governor really is, wants to do that, and the CDC guidelines, they want to do that, but it doesn't seem like a lot of the states are willing to do that at this point.
Well, everybody's having to learn on the go. We've heard repeatedly from the experts, how do you control this? We've looked at models in other countries that have done better, and it's having very readily available testing, which we still don't have, unfortunately, even months into this. Getting a quick turnaround and having contact tracers. We have somewhere around 120 to 150 in South Carolina, population about 5 million in the state. And they're forecasting that we would need 1,500 to look at the positives, who have you seen, and do their contact tracing work to try to do some quarantining. At some point, that's going to be government run, and they have to realize that's a better way to do this than to simply percolate along and hope that this goes away.
I agree with you. I think we need to do that. Even if we don't do it, I think that's what we should be doing. We have with us today Dr. Bob Barucki and Dr. Kevin Tomasak. You both are addiction specialists. I'm a pain and rehab board certified specialist. And we deal with medical and psychosocial issues and psychological issues. We all probably deal with some patients that are depressed, and now people are suffering with post-traumatic stress disorder and depression. Even my mother, who never gets depressed, says everybody's depressed now. What are we going to do with all these people? Yeah, my mother also said to me, she said, it's sad because she's been cooped up in her apartment in New York City. She's going to be 92 next week. And she said it was sad. She went out for the first time in like 3 months. And she said, I missed the season. I didn't see any tulips. They're all dead. So what are we going to do with all these people? in our country that are depressed, that have post-traumatic stress disorder.
You know, we'll do the best we can. Let's see what we can do about, you know, if we can start this economy churning up again. I mean, we brought it to a standstill, and it's not. People have this idea that it's just going to restart, and it's going to be, you know, this is going to be an ongoing problem for a few years.
Yeah. Dr. Tomasak?
Hopefully what we're going to see with the psychological aspect is just an acute reaction to the stressor, and that it will clear up on its own as things improve or get back to normal / near normal. And the good thing is humans can adapt, and I think once we learn to adapt and move forward from this with normal safety precautions, I think we will get over the stress of it, and hopefully that'll reduce the incidence of our PTSD and or our depression.
Yeah, I think that, you know, you and I have something in common. You were a chiropractor, you still are, and even though you don't practice that, and I'm a rehab doctor, so we sort of focus on the holistic approach.
Right.
And I think people are handling and dealing with fear right now, and anything we can do to help them, meditation, even build their immune system, help them with fear, and also help their bodies get stronger to help them cope psychologically as well as physically. Anyway, that's all I have for today, and I thank both of you for being here today. Anything else, Dr. Tomasak, you'd like to say in closing?
Not right now. Thank you for having me on.
Thanks. Dr. Bob?
Everybody stay healthy as best they can these days.
Okay, you got a haircut, I see, huh? You went to the...
No, I just slicked it back.
Oh, okay. I'm not getting my haircut yet either. I'm just doing buzzing. Anyway, have a great day. Thank you both for joining me, and I guess Deborah couldn't make it. So we'll talk another time. Thanks, guys. I appreciate it.
Thank you.
Thanks.
Thank you.